Greetings and welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Julie Kennel from The Ohio State University, Master of Dietetics and Nutrition program based in Columbus, Ohio. Check it out. All right, Julie, welcome to the podcast. To get us started for this episode, I would love for you to give us an introduction to you, your journey to RD, and how you landed in your position with The Ohio State University.
Thanks, Erin. I'm glad to be here and share with you more about my role as an internship director for the Masters in Dietetics and Nutrition at Ohio State. I believe my journey started a long time ago when I was introduced to 4-H. 4-H is a children's program, teenager program for teenagers, and it introduces them to farm animals and raising farm animals, but it also introduces them to nutrition. And I took nutrition projects every year for 10 years from age 8 to 18. And I just enjoyed learning about the role of nutrients in our food and food science principles. And I forgot about it for a while when I first started college. And then when I was not feeling like I was on the right path, I remembered how you should pursue something that you liked when you were growing up. And so I thought back to my days in 4-H and how much I loved those nutrition classes. And so I enrolled in a nutrition course and made my way to become a registered dietitian. I did my undergraduate work at Ohio State, actually double majored in exercise science and human nutrition because I wanted an extra year to finish out my ice hockey career at Ohio State. So I just tacked on another major there. And then I went to Case Western in Cleveland, Ohio for my internship. The thing I loved about my internship there is that it exposed me to so many different populations and sites in which a dietitian could work. But my heart was settled somewhere in research and knowing that I wanted to eventually become a professor. So after I graduated from Case with my MS and my RD, I went to work for Abbott Nutrition, and I helped them conduct the research that they do on their products like Ensure and Glucerna and infant formulas. But knew that at some point I'd have to go back to school to get my PhD, and I did at Indiana University. My PhD is actually in health behavior, so I really wanted to study like why people eat the way they do and how we could influence them. Once that was done, I landed a job back here at Ohio State. So I came full circle, which doesn't happen very often, and it's just a dream come true. I've known that I wanted to work in academia and be in this type of mentoring position, for 20 years. So here I am.
All right, perfect. I'm going to let you jump into telling us all about your program.
Okay, thanks. So our program is a coordinated master's program. It's coordinated because it serves a couple different populations. It serves individuals who have a DPD verification statement, and it also serves individuals who have completed a bachelor's degree in something else and now have decided that they want to be a dietitian and have completed a set of prereqs to do that. So our cohorts are varied in terms of their background, and I think that is a strength of our program. So we definitely use what's called the competency-based education system, right? We focus on teaching individuals skills that they're going to use as a dietitian and focus less on grades. And that can be a really difficult shift for many students because they've been trained for so long to like focus on the grade and how important the grade is, and the grade's going to lead to their internship. But during your graduate work, right, it really shifts into knowing like what skills are necessary and what do you need to be able to do well as a dietitian out in practice. And so we really embrace this competency-based education. And a lot of the feedback that we've gotten from our students so far is that that they feel a lot more comfortable learning. It takes the stress off, that they're able to take risks in their learning and do things that they might not have done if it had been attached to a grade. And so those are really fun things to hear from them. So we at Ohio State, this coordinated program was actually one of the first in the country, and that is because it was one of the first programs in dietetics to combine the didactic education with the supervised practice, and it did it at an undergraduate level, right, for so many years. This started back in the 50s. And we have a history as well with our dietetic internship and supervised practice through our human nutrition and program, as well as our medical dietetics program. So in other words, we've historically had a couple of programs here at Ohio State, and it's allowed us to build over 100 partnerships with supervised practice sites and work with over 150 preceptors. And so it's got a tradition, right? And it's got a history, and it also has a pretty big breadth and diversity to it. And we started a coordinated graduate program in the early 2000s, but what we've done most recently is change our coordinated program to serve the future education model that the Academy has put forth. So even though our MDN degree is relatively new, we've been doing this for a long time, and bring that history with us. So it's 5 semesters of graduate coursework, and those 5 semesters combine supervised practice rotations with the didactic component, the coursework. And what's nice about that is that our students, don't wait until their second year, right? Or don't wait until the second half of their program to start their supervised practice. They get started on it in their second semester, and what they see out there in the field and get to experience out in the field comes back to the classroom, and we get to talk about that. And vice versa, right? What we're talking about in the classroom obviously prepares them for supervised practice. But it's this integrated approach that I feel like is, again, a real strength of the program. And on top of that, those 2 components, our students also complete a capstone project. And this is just a project that helps them dig more into an area of interest. They get assigned with a specific faculty mentor, and that faculty mentor spends 2 semesters with them developing that project. That project often includes a literature review, but it also then has the student think about how do we use the evidence, how do we use the literature to create something useful for the public, right? And so sometimes it's a case study and walking through a case study, but oftentimes it has a component to it where the student is producing a publication or a series of publications or a series of blog posts or podcasts or whatever it is to talk more about what they learned in that literature review. So after those are done, then you're set to graduate and you're eligible for the RDN exam. It's a full-time program. It's in person. We do have some classes that are taught in a hybrid model or through an online model only. But for the most part, we're in person day in and day out in that full time. So we have our curriculum that I can share here and highlight a couple of things. It looks like we have a lot of focus on medical nutrition therapy, and we do. But in addition to that, you'll see elements built in related to communications, leadership. We have worked hard to figure out how to upskill our students so that when they graduate with this master's, it truly reflects a more advanced skill set. So, we hope to prepare them to be entrepreneurs, right? Or to work in the business setting, to be able to, offer value to a broader range of employers than what has traditionally, been there for dietetics. So a lot of our students are interested in that, and they just finished some pitch presentations, right? They spent a semester coming up with a new idea, right? A new app or a new program or service. And they did a lot of research, talking to people, talking to dietitians, what'll work, and refining those pitch presentations. And then that was a lot of fun to like hear them share their ideas. And a couple of them are going to move forward, like in terms of hoping to get funded to create the app that they propose. So yes, we do have a lot of clinical training, right? But we also have a lot of like leadership and different, entrepreneurship, skill development. And of course, we have electives built in here too. So we have, some of the most popular electives are sports nutrition or preventative health related. We're now building out some more pediatric, pediatric curriculum. So students get to choose, again, like to go more in depth in a particular area. So we really do try to elevate content to this graduate level by some of the things I just talked about, but we also use simulation with standardized patients. So our medical school is adjacent to my building here, and all of the health professionals are housed right under a pretty common umbrella of health and health sciences. And one of the simulations that we do involves all of those professionals together, right? And it's called Eclipse. And they study the same case, right? And they go to a simulation lab, and there might be like 10 students around the bed in that simulation lab, and their job is to like work together, right? Do the interprofessional education, work together to help treat that patient. And that's one of my favorite simulations that we do. So that when you graduate, right, the first time that you actually work with a physical therapist or a doctor or a nurse is not when you get that job. So we also do simulations for like nutrition focused physical exam. They just did a simulation educating people on cardiovascular disease. And so they got to assess their counseling skills, their counseling education skills, which is a passion part for me. So we have some really great resources here to be able to do those types of things. You can see here where our supervised practice rotation sites are. It's pretty common, but again, we have a wide range, right? So if a student has a particular interest, we do try, right, to match them up with that interest, and they have the culminating experience to identify their areas of interest as well. And that culminating is in their last semester, and is a pretty big part of the total 100 hours that are necessary to graduate from our program, 100 hours of supervised practice. These are the prerequisite courses. If you have a DPD verification statement, you have met all of these prereqs, even if you don't know it, right? We could just consider a DPD verification statement as equivalent to these prereqs. So this is only an issue if you are coming from a different route. So our program has a set of admissions that offers an opportunity for students to apply early. We have 2 deadlines a year. One of them is December 1st, and the other one is January 31st. But if a student applies by December 1st, they can know their status of acceptance within our program before the DICAS deadline, which is nice, because if they know they want to come to Ohio State, then they will have applied and gotten an answer, and can decide not to, pay the extra money and time to go through that DICAS process. So you need that bachelor's degree, transcripts, resume, statement of intent that looks exactly like your personal statement that is used in DICAS typically, the letters of recommendation, and those completion of all prereqs. So essentially, our applications process is the same as DICAS, but in this case, you don't go through DICAS, you go through the Ohio State Graduate School. That's where you're applying. We will interview after we receive applications, like in December. If you have applied by December 1, we'll interview in mid-January and give you a final decision by the end of January. If you don't apply until our January 31st deadline, then we typically interview in February, and we let you know in March ahead of the match, right? So if you apply by January 31st, you probably still want to apply to DICAS, but you can pull your name from the match process if you know you want to come here, and that way you don't end up with a match through D&D and then have to turn that down. It's perfectly fine, of course, for students to have options, but we want to try to avoid students from turning down internship matches. So we score, we do that interview, and then base our decision off of that. I will say that the interview is designed to get to know the student better and to really get a more comprehensive view of who they are and what they are hoping to accomplish in their career. All right, do we have money for students? A little bit. All right, we have a few mechanisms in place, which include university fellowships. They're competitive, they're highly competitive. One of them is based purely on merit, so pretty much based on your academic achievements. An individual would be competitive for this if they have like a 3.8 GPA or higher. And then we have graduate enrichment fellowships for students who will bring some diversity to Ohio State. And here the GPA could be a 3.5 or a 3.6. And then that diversity element. And so anyone who applies by our December 1 deadline will automatically be considered for these both of these fellowships. To have your chance at some of the university money, you want to hit that early deadline. There are other mechanisms, of course, for funding that we share on our website. That you probably know about in terms of scholarships from the Academy of Nutrition and Dietetics, or some local scholarships to Ohio here. So here's our resources, right? And I look forward to answering some additional questions.
All right. Thank you for that overview of the program. I'm going to jump right into the 5 questions that I ask all of the programs that come on the podcast. And these were put together with the help of my students to make sure I was asking the questions that they really wanted to know the answers to. So my first question is, what is one thing in particular that you just really love to see when reading applicants' personal statements?
Yeah, I would love for them to tell me a story, right? Tell me a story of who they are and how they came to dietetics, some maybe pivotal or transformational moment in their lives.
All right. When thinking about resumes, true or false, an applicant's resume should be 1 page and 1 page only. Either way, why?
True. I like a short resume. I like students to be able to discern what is useful or applicable or shows off their skills and talents. And so, yeah, I'm going to go with 1 pager.
So my third question is my favorite question to ask directors and programs. And this could be one thing or more than one thing that an applicant may do that might raise a red flag to where you might think, this applicant's not the best fit for this type of program.
Yeah, I like this question a lot, and I've done some thinking about it. And I think the thing that I can say most is a closed mindset, right? So just feeling like they don't have a lot of room for growth, that they need this program, but they pretty much already know all the important things, and so so that's really important. That would be a huge red flag for us to feel, to have an applicant who isn't just ready to embrace all of those opportunities that present themselves in their advanced studies.
All right. So what is one thing about the program that you feel really separates you from the competition? Because there's a lot more programs that are future education model programs that are popping up, it seems like, every week. So what do you feel is really capturing applicants?
I know. I want to say things like our amazing faculty who are supportive and intelligent and have won teaching awards. I want to say that, but I know that exists elsewhere, right? And I want to say, the unlimited opportunities that you have when you come to a huge institution like Ohio State. But I know that exists elsewhere too. So I've been thinking about this, and so one thing that might illustrate some of the strengths of this program are the fact that our medical center, our main hospitals, overlook our football stadium, and both of them are 5 minutes from my office. And so I think just knowing, right, that we provide experiences on one side of the paradigm, if you will, in terms of health, wellness, athletics, working with active people, all the way through, right, to like a level 1 trauma center, seeing patients who have unique cases that you don't get to see at every hospital, and kind of everything in between, right? So I think that's one thing that might make us a little bit unique from our competition.
All right. So my last question of the 5 is a 2-part question. So the first part, what would be the 3 best, and these can be adjectives, descriptors, or phrases, that you feel best describes the program overall?
Challenging, innovative, and I want to say community, right? So, I do think we have a challenging program here where we push our students to grow and develop, and they'll go through phases of feeling like it's a lot or it's overwhelming, and then they'll start to make the connections that really show that they're putting all the information that we're sharing with them together. And yeah, I think we push a lot in terms of having them prepare for supervised practice. So the coursework isn't just about memorizing material and then being able to regurgitate it on an exam. It's challenging students, right, to use their motivational interviewing skills and to be able to work and talk with professions that we share space with, and get creative with their idea thinking. So I think we're challenging in a lot of regards. I also think our program is somewhat innovative because we utilize these different teaching methods. Like every class has a different set of activities and ways of assessing them. So yep, you're going to see case studies, but you're also going to go and talk to paid actors. You're going to work on nutrition coaching with people you don't know. You're going to watch recordings of yourself, doing those things. You're going to do these pitch presentations like I talked about. I just think we strive to really offer innovative ways of educating students that are designed really, to help improve their overall learning and preparation. And then that last one, right, of community, like that's really important to me. That we're not just checking off boxes and chugging through things. It's about us, it's about us learning together, right, and learning who each other are, and learning our different strengths, learning what people bring to the community, supporting each other. Like this past couple of years, right, and pandemic has really brought to light like the importance of showing up for your classmates, right, and showing and as instructors showing up for our students, and really showing them that we care about them, and we want them to succeed. And so we kind of build like a collaborative culture, do a lot of like community building within the classroom, primarily to create that culture.
All right, so the second half, very similar to the first, the 3 best adjectives, descriptors, or phrases to describe your ideal applicant.
All right. I like to see a student with an open mindset, right? They come just ready to absorb. They come ready to immerse themselves in, yes, the material we're sharing with them, but also, material that they have at their disposal that we might not have mentioned, just so curious and like immersed, and desiring, that open mindset to just be, immersive in their studies, is a big one that comes to mind. We also want students who have a little creativity, right? In dietetics, we might tend to train students to be more linear in their thinking, or more, black and white, or the calculations, or, there's a right way and a wrong way of doing things. But really, our creative abilities serve us very well in a number of capacities. And so I love students who like share some of that creative side. And that could be like, yes, a creative endeavor. Like maybe they have a side interest in painting or sculpting, or of the arts in some way like that. But creativity is also just about like being willing to think outside the box. So that comes to mind. And then let's see, one more. I think it also is really nice when students know their purpose, or know, are on the right track in trying to like determine what their purpose is. So a lot of people talk about passions, right? And all of our applicants are passionate about dietetics. They're passionate about helping other people. But the purpose, right? Our purpose goes beyond that. It goes beyond those passions. And so students who kind of know what that purpose is, like why they get up day in and day out, right? And why they're investing so much in this education, and the big hopes and dreams that they have for themselves post graduation.
All right. Well, I just have a couple of extra questions. You mentioned this earlier with the pandemic. So what would you say has been the number one improvement to the program that was born out of the pandemic?
Yeah. Telehealth. I could say a lot of things, but telehealth comes to mind. And, at first I was very concerned about students not being able to, educate, counsel in person. And so we switched, right, to a lot of telehealth activities. A lot of them were working with preceptors, either inpatient or outpatient, through a telehealth process. And I don't think it's going anywhere, right? I think it's another way for dietitians to reach target populations, and to reach populations that we haven't historically reached or reached well, right? So yeah, just kind of leveraging the opportunity and some of our graduates, got jobs immediately in places where they were doing telehealth. And one of the reasons they got that position is because they had experience doing telehealth in their internship. And so we want to keep a little mix of the virtual work, right, or the telehealth in our program, to, again, kind of like upskill or offer something different than what others might not have. So yeah, we learned quite a bit, but I think that's a real plus that happened from the pandemic.
All right. So my last question, how do you currently integrate RD exam review into your program?
I gave an exam last week. I gave a final that looked a lot like the questions you would see on the RD exam. And so certainly rolling those into all of our courses is an important step in that process. And aside from that, we also provide students with a comprehensive exam review, right? We either pay for, well, there's two major ones out there. So we bring one of those in for the students so they can do it in person. So they do like a 2-day workshop to prepare them for the exam. And they can do that in person. And then we also have other resources that they use, on their own time. So we use visual veggies. We use those comprehensive ones are the Gene Inman, or the one that starts with a B. I'm blanking right now.
Breeding and Associates.
Yeah, Breeding Associates. Thank you. So all those resources are there, but we spend time in our last semester. We have a seminar class in our last semester, and we spend time in that last semester talking about jobs and preparing for jobs, but also preparing for that RD exam. And so, helping them to like see what has worked for them in terms of their study habits so far. Everyone has a different way of studying. And so they just, need to know like what that is for them, what's ideal for them, and creating a plan for studying for the RD exam that reflects how they learn best. and then starting to use that plan or put that plan into action, so that they're ready to take the RD exam, right upon graduation or shortly thereafter.
All right, well, that was all the questions that I had for today. I would love to close out this episode with a quick take-home message from you to potential applicants.
Follow some combination of your heart and your mind, right? But don't forget about your heart. Just really investigate all the different options out there, and then go with what seems to be the best fit, right? And not because somebody else thinks it's the best fit, but because you think it's the best fit for you.
Thank you again, Julie, for being with me on the podcast. And for those at home who would like some more information on the Master of Dietetic and Nutrition program at The Ohio State University, I've included their program website link in the description below this video. And as always, don't forget to like and subscribe so you never miss an episode, especially those with another awesome dietetic internship. And we'll see you next time. Bye.